Complete anatomy guide. Spine model, knee joint model and shoulder joint model explained. Hello everyone, and welcome to our channel. In today's video, we are going to explore three of the most important parts of the human musculoskeletal system: the spine, the knee joint, and the shoulder joint. These structures are essential for movement, balance, posture, and daily activities. Understanding their anatomy is important for medical students, nursing students, physiotherapists, fitness professionals, and anyone interested in learning about the human body. Let's begin with the spine. The spine, also called the vertebral column or backbone, is the central support structure of the human body. It provides stability, supports the head, protects the spinal cord, and allows flexibility for bending and twisting movements. An adult human spine is made up of 33 vertebrae. These vertebrae are divided into 5 regions. The first region is the cervical spine, which contains 7 vertebrae. These vertebrae support the head and allow movements such as turning, bending, and nodding. The first cervical vertebra, called the atlas, supports the skull, while the second vertebra, called the axis, allows the head to rotate from side to side. Below the cervical region is the thoracic spine, consisting of 12 vertebrae. Each thoracic vertebra connects with a pair of ribs, helping form the rib cage that protects the heart and lungs. The thoracic spine is less flexible than the cervical and lumbar regions because it provides stability for the chest. Next comes the lumbar spine, which contains 5 large vertebrae. These are the strongest vertebrae in the body because they support most of the body's weight. The lumbar region allows bending and lifting movements and plays an important role in maintaining posture. Below the lumbar spine is the sacrum. It consists of 5 fused vertebrae that connect the spine to the pelvis. The sacrum transfers body weight from the upper body to the legs during standing and walking. The final part is the coccyx, commonly known as the tailbone. It is made up of 4 fused vertebrae and serves as an attachment point for several muscles and ligaments. Between most vertebrae are intervertebral discs. These discs act as shock absorbers and reduce friction between the bones. Each disc has a soft gel-like center surrounded by a tough outer layer. Healthy discs help the spine remain flexible while protecting it from excessive stress. Running through the center of the vertebral column is the spinal canal, which contains the spinal cord. The spinal cord is one of the most important parts of the nervous system because it carries messages between the brain and the rest of the body. Damage to the spinal cord can lead to serious neurological problems. Strong ligaments and muscles surround the spine. These structures maintain stability while allowing controlled movement. Proper posture, regular exercise, and correct lifting techniques help maintain spinal health throughout life. Now let's move on to the knee joint. The knee is the largest and one of the strongest joints in the human body. It connects the thigh to the lower leg and allows movements necessary for walking, running, climbing stairs, jumping, and sitting. The knee joint is formed by 3 main bones: the femur, the tibia, and the patella. The femur is the thigh bone and is the longest bone in the body. The tibia is the larger bone of the lower leg and bears most of the body's weight. The patella, commonly called the kneecap, protects the front of the knee and improves the efficiency of the thigh muscles during movement. A small bone called the fibula lies beside the tibia. Although it does not directly form the main knee joint, it provides support and serves as an attachment site for muscles and ligaments. The ends of the bones are covered with smooth articular cartilage. This cartilage reduces friction and allows painless movement during joint motion. Inside the knee are 2 crescent-shaped pieces of cartilage called the medial meniscus and lateral meniscus. These structures absorb shock, improve stability, and distribute body weight evenly across the joint. The stability of the knee depends heavily on its ligaments. The anterior cruciate ligament, or ACL, prevents the tibia from sliding forward. The posterior cruciate ligament, or PCL, prevents backward movement. The medial collateral ligament, or MCL, stabilizes the inner side of the knee, while the lateral collateral ligament, or LCL, stabilizes the outer side. The knee also contains synovial fluid, which lubricates the joint and nourishes the cartilage. Without adequate lubrication, movement would become painful and damaging. Large muscles surrounding the knee provide movement and strength. The quadriceps muscles at the front of the thigh straighten the knee, while the hamstring muscles at the back bend the knee. Together, these muscles make walking, running, and jumping possible. Common knee injuries include ligament tears, meniscus injuries, cartilage damage, tendon inflammation, and arthritis. Maintaining a healthy weight, strengthening leg muscles, and exercising regularly help reduce the risk of injury. Now let's explore the shoulder joint. The shoulder is the most mobile joint in the human body. Its remarkable flexibility allows us to reach, lift, throw, push, pull, and rotate our arms in almost every direction. The shoulder joint is mainly formed by three bones: the humerus, the scapula, and the clavicle. The humerus is the upper arm bone. The scapula, or shoulder blade, provides attachment points for many muscles. The clavicle, also called the collarbone, connects the shoulder to the chest. The main shoulder joint is known as the glenohumeral joint. It is a ball and socket joint in which the rounded head of the humerus fits into the shallow socket of the scapula called the glenoid cavity. This design provides exceptional mobility but also makes the shoulder more prone to dislocation. The shoulder is stabilized by a group of four muscles known as the rotator cuff. These muscles include the supraspinatus, infraspinatus, teres minor, and subscapularis. Together, they keep the head of the humerus centered in the socket while allowing smooth and controlled movement. Several ligaments strengthen the shoulder joint by connecting bones together. The joint capsule surrounds the entire joint and contains synovial fluid, which lubricates movement and reduces friction. Small fluid-filled sacs called bursae reduce friction between muscles, tendons, and bones. When these bursae become inflamed, a painful condition called bursitis may develop. The shoulder can perform flexion, extension, abduction, adduction, internal rotation, external rotation, and circumduction. This wide range of movement makes it essential for sports and everyday activities but also increases the risk of injury. Common shoulder problems include rotator cuff tears, shoulder dislocation, frozen shoulder, tendinitis, bursitis, and arthritis. Regular stretching, strengthening exercises, and proper lifting techniques help maintain shoulder health. Although the spine, knee, and shoulder have different structures and functions, they work together continuously. The spine provides support and balance. The shoulders position the arms for countless tasks, while the knees allow efficient movement and support body weight. Every step, every lift, every turn, and every athletic movement depends on the coordinated function of these remarkable anatomical structures. A clear understanding of these models helps students visualize real human anatomy and prepares them for clinical practice. Anatomy models are valuable educational tools because they allow learners to identify bones, ligaments, muscles, cartilage, nerves, and joints without requiring access to a human specimen. Thank you for watching this complete anatomy guide on the spine model, knee joint model, and shoulder joint model. We hope this video has helped you better understand the structure and function of these essential parts of the human body. If you found this lesson helpful, please like the video, share it with your friends and classmates, and subscribe to the channel for more detailed anatomy lessons. See you in the next educational video.